Hi, I'm David Huey. I work for the Washington County Sheriff's Office in the Patrol Division. I started working for the Sheriff's Office in 2015, and I've been with a team called MHRT, which is our mental health response team, for the last about 2 years. It's my favorite assignment so far. Traditionally, a patrol deputy is going to respond to a number of different types of calls for service that come in through dispatch. What's unique about my position with MHRT is we respond to calls specifically that deal with mental health or a mental health component. Some of the differences specifically are going to be additional training that MHRT or mental health response team deputies receive for crisis intervention training or other mental health first aid type things. A significant number of calls for service have to do with a mental health component, and where maybe in the past those things have been missed, we're recognizing them more and more every day as we kind of go on the road, and it helps us to de-escalate in uses of force when really we just use our best communication skills to try and de-escalate. Every deputy with MHRT rides around with a mental health clinician. So it's a master's level clinician that's staffed through one of our partner agencies, and we ride around as a team responding to calls for service that have to deal with mental health issues. So that could be folks just in crisis. Oftentimes it's people that are on their worst day, folks with a diagnosed mental illness. Some folks that haven't been diagnosed but are showing symptoms of, and their families calling them in. People that deal with addiction. Oftentimes that will lead into something that will be a crisis situation that we'll respond to. As an MHRT resource, oftentimes we're going to respond to specific calls. Some of those calls being suicidal threats. We get those fairly often, where people are just on their worst day and they don't see their way out of the hole they're in. We'll respond to overdose calls. So those can, again, be linked to either a suicidal attempt or just folks who've just kind of taken too much of something. Either it's prescription or it's an illegal drug. We work with a lot of folks who are dealing with a diagnosed mental illness like schizophrenia or bipolar or mood disorders. And so with the help of my clinician, she has a lot of access to other resources that I might not see on the deputy side. So we work in tandem, and it works really well as a team. One of the things that makes our team unique, again, having that clinician in the car, is that we have the opportunity to read our situation as we're walking into it. So each call is different in the characteristics of the call for service. But for example, I might have a 17-year-old girl who just went through her first breakup and she's suicidal. I'm probably not the best person to talk to that client, but my clinician might be. On the opposite side of the coin is I might have a male veteran who just doesn't want to talk to a female, and I might be the better person. So we have to kind of read those calls in an instant and figure out who the best person is to relate and build rapport with that client. As the mental health response team, oftentimes we can do a hospital diversion, where we'll come in as a unit and we'll be able to see something that maybe that the traditional patrol deputy just isn't quite seeing yet, and that the hospital is a better option rather than taking someone to jail. MHRT is a unique team with our Sheriff's Office in that we have the ability to ride with the clinician. It's been a fantastic attribute. It's one of our many special teams. If you want to hear more about it, or you want to see what other special teams we offer, check us out at joinwcso.com.
With mental health increasingly becoming an issue local law enforcement has to deal with, more law enforcement agencies are trying to work on ways to respond to that. The Vancouver Police Department, for example, recently announced it would be adding full-time mental health responders to work with its officers in the field. As Fox 12's Simon Gutierrez explains, the Washington County Sheriff's Office has had a running start at that kind of program, and deputies say it's paying dividends at the street level.
Responding to calls, Deputy Shannon Wild generally prefers a soft landing.
I just really try and be myself. I humanize myself. I usually introduce them by my first name.
The people she encounters on a daily basis are often struggling with something.
What typically happens when you get on a scene? Like, what's that interaction like?
It's for the most part, it's really positive. There are people in crisis, and when we tell them, hey, we have someone here that's not a cop that you can talk to, that has resources and a different perspective, most people are really responsive to talking to someone who's not law enforcement.
That someone is Christy Harangozo, a clinical social worker who rides next to Wild.
I think the great thing about what we do is we're able to really slow down and just try to work with the person, find out what can really help them at that moment to stabilize that situation that they're experiencing.
They're part of the Washington County Sheriff's Department's mental health response team, which puts the needs of people suffering from a mental health condition ahead of punishment in the case of low-level offenses, with the realization that a trip to jail would likely result in the person being back out on the street in a matter of hours.
And so if we can divert that person, help them get some resources or get to a hospital if that's what they need, it's better for them, it's better for the community, and it's better for us.
In 2019, the mental health response team responded to more than 2,000 behavioral health incidents, offering people immediate intervention and a path towards services like counseling or drug treatment. The team also responded as support on more than 3,000 criminal investigations.
I think most of the time people are really receptive to the fact that we're out there and that I'm coming as a civilian and as a counselor.
In the event that a person isn't receptive or wants to be left alone, Wild says they typically back off unless they think that person is a danger to themselves or someone else. But Wild says most people appreciate the opportunity to talk.
There's a common misconception out there that people with mental illness are dangerous and violent, and of course they can be, but that's not the norm. Most people we go out in the community and engage with are calm, they want help.
In Washington County, Simon Gutierrez, Fox 12 Oregon.